Hello. I am often asked a question on social networks about how to motivate an older patient to change their lifestyle. Honestly, the question is very relevant and the answer to it. It will be ambiguous, yes, and it is actually not an easy task. Because, as a rule, people of a lower age group are trying to change the lifestyle of a patient of an older age group, who are less authoritative for these people, and they are sure that they have lived to their years, and, in general, you do not need to listen to anyone. Well, especially some young people who think it's easy for them to change everything. Well, this, of course, is objectively so. Here. But, of course, this is a manifestation of care. Yes, these younger people, they can be relatives, they can be doctors. Here is anyone who wishes good to man. Actually, how to do it. If you are a relative of a patient who needs to change his lifestyle and you know exactly how to change it, and you, for example, the doctor himself, of course, it is almost useless to explain this because parents usually do not listen to children. Well, in terms of some such moments, yes. Complex, yes, in which you need to be well understood. It is better to send it to a specialist. Even if you're a professor, even if you're an academic, chances are your parents won't listen to you anyway. Therefore, it is better to direct to someone else. But someone else will already be engaged in very painstaking work. Explain. Who will, if not treated, yes, all the complications in detail, what can be specifically with this patient, yes, explain that. Most likely, from chronic diseases, well, from the majority, for example, from diabetes mellitus as well. Not that they die, but rather they are disabled. That is, this feeling of disability, it prevails over death, because it lasts longer than a period of time. It brings more trouble, it is very painful. Therefore, the second point is to explain why to take each drug. There can be a lot of drugs. But each must be verified and exactly indicated why. If we explain this to the patient, it is very likely that he will follow most of the recommendations, sometimes all. Well, it's rare to come across super disciplined patients to whom you write everything inside and out, all recommendations, for the year ahead, for example. And the patient controlled everything a year later, he comes, says, here, he reports, I did everything, this way and that, everything is fine. You tell him, fine, keep up the good work. But most patients don't. And they have to, even if you have already explained to them 10 times how to treat. More precisely, not how to treat, but why take a specific drug, from different angles. All the same, next time he can come and ask, why? This is not on purpose, in no case should you react to it, how to speak negatively, that's what you are specifically mocking. They are not on purpose, people simply do not know, do not understand many things that are obvious to doctors. And naturally, they will go and ask until they finally fully understand that they really need to take the drugs why. And this is why it should be clear to the patient. You may not find it the first time. Therefore, here is the patient's complication, which is determined, yes. Actually, or it is revealed, yes, and by how many medicines a person takes from how much he needed, yes, and from what recommendations he makes for lifestyle changes and nutrition, and so on. Here, all this compatibility is a huge work and a constant one. That is, let's just say that if you are not sure about the patient that he will follow the recommendations, you can let him go for a while, he will return, you will once again talk to him how he does it, whether there are any difficulties. That is, there should be partnerships, absolutely. Of course, imagine if an elderly person to tell in such an educational or instructive tone, yes, what needs to be done, how. Here, he, of course, will send you to hell and will not do anything. That's why you have to strike a certain balance, yes, despite the fact that you probably know everything better, yes, than these people, but these people know one thing, they lived a long time, they lived their lives the way they wanted it, and you have to give them the maximum motivation, the maximum explanation of why. They now need to change something, what exactly will improve for them in this. In this spirit, if you want to discuss in detail, maybe at the premieres, we can broadcast on Instagram, right too. Comments when it's convenient, here, we'll hold it, no problem. Thank you, happily.